So let's think about how we're actually going to memorise these cranial nerves. And I really like to use mnemonics. Mnemonics are great fun. And just on a personal note, I actually memorised the cranial nerves when I was 19. And if you memorise them when you're young, as you probably are watching this video, then you'll remember them for the rest of your working life. So how do we remember them? Olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. Well, the most ancient mnemonic in the history of anatomy, I think it's probably a couple of 100 years old. It's this. On old Olympic table tops. Now there's different versions of this. I'll give you mine first. A fair and gaudy virgin shall hop. That's the one I learned. Now that's a very old-fashioned one. Gaudy's an old-fashioned word. It means kind of over made up. Now the newer version of this, there is a slight proviso there. We used to call the vestibulocochlear the auditory. We now call it the vestibulocochlear. Now the newer version of this is on old Olympic tabletops, so that's the same. A Finn and German viewed some hops. So on old Olympic tabletops, a Finn and German viewed some hops. Quite why would they want to view hops, I don't really know, but never mind. Anyway, I found another really good one on the internet recently. It was, on occasion, our trusty truck acts funny. So, on occasion, our trusty truck acts funny. Then the next bit is very good vehicle anyhow. And that's good because it gives you a V for the vestibulocochlear. So, on occasion, our trusty truck acts funny. Very good vehicle anyhow. Now this video is for public consumption, so I hesitate to speak further, but on the internet you'll certainly find versions which are less acceptable by modern standards. To touch and feel. I won't give you the rest of that. It's available on the internet if you're so inclined. Some people do manage to memorise obscene versions. Anyway, enough of that. Now, it's also good to remember what is motor and what is sensory. So which of these nerves are motor and which are sensory? And again, there's a fairly standard mnemonic for this. Some say money matters. Some say money matters. But my brother says big brains matter more. So some say money matters, but my brother says big brains matter more. And these of course stand for sensory. S for sensory. M of course is for motor. And B is for both. So there we have that one. Some say money matters, but my brother says big brains matter more. So we see the olfactory nerve is sensory. That's true, we know that one. The optic nerve is sensory, carrying impulses from the nose, carrying impulses from the eyes. Oculomotor, well, oculo, eyes, motor, movement. Trochlear, remember the pulley nerve, the one that acts as a pulley on the eye muscles. It's very important, it's a small nerve, but it's very important for preventing double vision. Is motor. Trigeminal, both. The upper two branches are sensory, the lower branch is motor, controlling some of the muscles of mastication. Abducent again, abducens to move away, the one that controls the lateral eye muscles to look out the way, purely motor. Facial is both, that's right. Vestibulocochlear, taking impulses from the vestibular apparatus in the inner ear and the cochlea, the organ of Corte and the cochlea, the spiral organ, entirely sensory, that's correct. Glossopharyngeal is both, glosso-tongue, pharyngeal, throat. Vagus, remember the vagus is from vagrant, the wandering nerve, that's certainly motor and sensory. Spinal accessory, the accessory nerve is only motor, shrugging the shoulders and moving the head, and the hypoglossal, the tongue and under the tongue. So that's all right, that mnemonic works. Some say money matters, but my brother says big brains matter more. Excellent. Now when I'm here, I think I'm just going to talk a little bit about the nuclei. So clearly these impulses arise, the olfactory impulses arise in the nose, and they actually end up in the temporal lobe. You smell with your temporal lobe. And the optic nerve goes to the occipital lobe at the back of the head. Now the oculomotor nerve and the oculomotor nerve and the trochlear nerve are both midbrain nerves. Controlled by the midbrain. So what we're actually doing here is the nucleus. Because remember, the cranial nerves are lower motor neurons, so the nucleus is in these parts of the brain. Now the trigeminal nerve, remember we start anterior and we move back the way for the cranial nerves, don't we? So the nuclei for the trigeminal nerve is in the pons, and the nuclei for the abducent nerve is in the pons also. Now the facial nerve, the seventh nerve, again the motor component there is controlled from a nuclei in the pons. The vestibulocochlear, well that's actually the pons. It's slightly complicated, that one. The vestibular component from the vestibular apparatus goes to the pons and the medulla, but the cochlear component goes just to the medulla, I think. So that's the pons and the medulla. But again, it's consistent with this idea of working back the way from anterior down to posterior. Glossopharyngeal, this is nerve number 9. Well, as you would expect, working back, the nuclei for the motor component of the glossopharyngeal is in the medulla. Which is short for medulla oblongata, pronounced medulla in American English. Going back, as you would expect, the vagus nerve, again it's the medulla oblongata, the motor nuclei. Now the accessory nerve, as we've discovered in recent years, actually the motor components from that arise from the cervical spine. It's an unusual one because the motor fibres arise from nuclei in the cervical spine, go into the cranial cavity and then back out again. And the hypoglossal, carrying on with the trend of going back, is the medulla again. The medulla oblongata. So this is fairly consistent with our thinking about the cranial nerves, where remember we had 1 and 2, then we had a batch of 6, 1, 2, 3, 4, 5, 6, taking us to there, and then we had the last 4 taking us down 2, 6 and 4. So the first 2 arise before the brain, the next 6 are associated with the midbrain and the pons, although the vestibulocochlear's got some nuclei in the medulla, and then the last 4, the medulla or the cervical spinal cord, as we work posteriorly. So just a few aid memoirs there. But sounds complicated, but learn it when you're young, use it a few times and you won't forget it. And this really is one of the classical pieces of physiological related anatomy that everyone should have at least some idea about.